You mentioned congestive heart failure, and certainly that's not an ailment that's specific to one part of our population, but for folks in rural communities who often can be hundreds. I grew up in Ohio, and certainly, there were some specialists where it was a pretty good morning's drive to get in to see somebody,
Sure.
and, God forbid it's an emergency. Can you talk about some of the technologies that are really helping rural patients who may have hundreds of miles to drive toward a specialist? Could you talk about some examples of telemedicine and new technologies that's closing that gap?
Well, for the rural population, the rural marketplace, the value of this kind of an approach has been demonstrated for years. Because remember I said that we can think of three kinds of value points: quality, access, and efficiency. And for the rural citizens of our country, it's really an access value proposition. So a place like this, Partners Healthcare, the Harvard Teaching Hospitals here, we have, I think, 4,000 specialists spread across a tiny geography in Boston. And if you happen to live on Beacon Hill here, you can have access to that top quality care. But if you live out in the western part of our state, so it's a little more of a sparse. So the idea that we can connect you to high quality expert resources using this kind of a tool is very compelling for citizens in the rural part of the country.
Moving forward, what are some challenges that you can foresee for telemedicine and its continued advancement and use?
Well, I always talk about usability. I mentioned that earlier, but right now the technologies, we find ourselves, no matter how much is out there, we still find ourselves cobbling together solutions. We still find patients who like my dad or my in-laws, my in-laws are in their 70s, my father's 87, they just aren't comfortable with this stuff. So, yeah, we know we can do it because of products like the iPod and the iPhone that are just so dead simple to use. We need more of that in our industry. More simplicity, more interoperability, more plug and play. So I think that's one challenge. What I used to call a challenge, which was provider adoption, seems to be going away. Physicians, for the most part, are pretty eager to participate in these kinds of programs nowadays. At least in our backyard. I think that's partly because we're bathed now in this quality reimbursement mindset, pay for performance. And people are seeing not only how busy they are and how hard it is to get a day's work done, but then there's all this quality metrics they have to pay attention to. So these kinds of tools, as I said earlier, become very attractive in that regard. So I don't see that as a barrier. The ubiquitous deployment of a really high quality, high speed network would be a great tool for us. Because now some places we go to dial up. We use wireless. Wireless is quite variable in its reliability and its quality of service. And for medical applications, you want a high quality of service network.
Sure.
The consumer networks that we have are okay for things like emails and text messages between my kids, but if that text message happens to be carrying your heart rate to your cardiologist, you want it to be reliable and of high quality.
Yeah, I think you listed a great number of them. The one that comes back to me, though, is kind of this question of infrastructure. So absolutely the quality of the network that we have, that we're able to leverage, but also the quality of the interoperable systems and the quantity of interoperable systems. So that can be whether it's medical records, so that we can share vital patient information when we need to with the right kinds of people. And also that the technologies that we have, so for instance, maybe an iPod or an iPhone, we can make that work fairly easily, fairly straightforward with stuff like, the blood pressure cuff or the weight scale. So how to put all those kinds of technology pieces together and make the infrastructure more of a puzzle that fits much more neatly than it does today.
Sure.
And then, again, leverage that big infrastructure that allows us to have the same kind of access and quality in terms of an infrastructure standpoint for our rural communities as our urban.
All right.